All right. Um, Welcome to part two of Hope Corps' launch of our community health worker training and certification program. In part one, I went over the overview of the program. Now I'd like to break it down into the steps that are going to be needed to launch this program and go into a little more detail into those steps. So the first thing we do is focus on the flip chart campaign on COVID-19 that we've already started. So certainly for the 750 community health workers that we have already trained on COVID-19, we want to be sure all of them have that flip chart, and now we're getting more and more produced and get them into the field so each one of those community health workers gets to all of their 50 households as quickly as they can. Definitely in the next 3 to 4 weeks, I would like to have them contact all their households. We need to focus on the fact that the COVID epidemic has not yet come to Thuraka-Nithi, so this is the safest time to go into the households and prepare them in case this epidemic gets worse. I know some of the community health workers have been afraid. They don't understand the situation. They're afraid for their own health for going into the households. If they understand that we don't have it yet in our area, they're going to be more comfortable, more motivated to go into the household. So that's the first thing, is most of our team is going to be focusing on getting the first COVID-19 flip chart campaign done in the next month. That's our goal, to get it completely done in the next month. Not that in future campaigns we won't go back and repeat, because remember, for our clients, repetition, repetition, repetition. This is what gets these new behavioral things like washing your hands with soap and wearing masks when you're in public and social distancing. That has to be worked over and over and over again. So that's the first thing. Let's focus on what we're doing right now. The second thing is that the leadership in Kenya, obviously Naomi and Achesa and maybe some of other of you need to be involved in working with the Ministry of Health to get their okay and a memorandum of understanding. And what I'm going to recommend, and this I'll talk to Naomi about in detail, but and all of this then can be changed. None of this is cast in cement, but since we do have a very good contact with the Minister of Health for Thuraka-Nithi, I think we should make a presentation to him via Naomi, basically saying that we have been able to put together money from our foundations to combat the COVID-19 epidemic. And in doing so, we have developed this program to reach eventually all 1,000 community health workers in Thuraka-Nithi, and begin this program of training them, certifying them, and moving towards getting these 10 campaigns that I talked about in part one out to that community over a year. And obviously the first one we want to do is COVID-19. So we need to get the partnership with the ministry. We need to be sure that they have some ownership in it. Hopefully in some of our trainings, their own employees will be involved. I would hope to use their facilities whenever we train. I don't want to pay extra money for facilities. And also I want to just get them involved in this as deeply as we can. So that if we do create posters, whatever we do, we will do this as a joint Hope Corps Thuraka-Nithi Ministry of Health program. So the memorandum of understanding is going to be very important. We need to think about that. Probably Naomi, you need to talk to your team and then do a run through and then present that to me and Ann and Ariane and come up with all the things that should be in that memorandum of understanding. So first of all then, we are going to focus on getting the flip chart out, as we're doing now, to our 700 community health workers for COVID-19. We're going to have another group working on getting a meeting with the Ministry of Health locally and getting a memorandum of understanding so that we do this and we get their okay to run this as a program over the next year, and make them understand that we will be doing other things besides COVID-19. But the key is we will start with COVID-19, and then depending how the epidemic goes, every 4 to 6 weeks when we run a new campaign, we will revisit COVID-19 as well as taking on a new campaign such as WASH. So repetition, repetition, repetition. And again, the more repetition for our clients, the better, and the more repetition for our community health workers, the better also, because as they see these flip charts and use them over and over and over again to their 50 households, they're going to come to know the information on those flip charts extremely well. And so what we invest right now in their training will come back to us in a year when they're fully trained, and that we can take them even further into other areas of community health work and other areas that are important of health in the community. So memorandum of understanding, focusing our team of getting all 700 current community health workers with their charts, get them to know how to use the charts. And then the last thing I want to talk about in this video, and the most important, is the selection of the 50 supervisors for the community health workers. And that would mean one community health worker supervisor for every 20 community health workers. Now, if we had all 1,000, which we may not, because in the beginning we may not be doing the Rocket North and South, or we may be doing it in a different fashion, we may only have 700. But whatever, we're going to need one community health worker supervisor for every 20 community health workers. Now, how we select and who we select is extremely important. So I would like to send our nursing staff and our teams into the field to work with groups of our community health workers. And in the process of working with them, obviously in small groups because of COVID-19, but in the process we want to be alert for those community health workers who seem to be motivated, who seem to be intelligent, who seem to be the movers and the shakers in the community, the people who really have the ability to get something done, and the people who are really interested, seemingly interested in working with us, and also looking for those community health workers that seem to already have the respect of some of the community health workers around them. So some people have that, if you wish, the charisma, that special energy that other people latch onto. And those are the people we want. Now, again, when we find our community health worker supervisors, we are going to offer them an increased salary and incentive to do this, because it will be extra work. And their job will be, first of all, to get the trainings from us. So every time we start a new campaign, we will make a new flip chart. We will then meet with them in different parts of the county. We will present them with their 20 flip charts that need to go to their community health workers and explain to them in detail how to work those flip charts. Then that community health worker supervisor will be responsible for training her or his 20 community health workers, and then going out and spot checking, going out in the field one-on-one and seeing how they work within the community, within the households, and then feeding back to us what seems to be working, what seems to be not working, and what we can improve on. Again, when you start a program like this, you really don't know all the details that are going to be needed to finish it. So that's going to be extremely important, is to listening to our community health worker supervisors. They are going to be extremely important to us to make this program successful, because if they're well motivated, if they're excited, and if they're well trained by us, then they will take that to each of their community health workers, and that will then be brought to each of those community health workers' 50 households, and that's what we're really focusing on here. So selection is going to be important, and that's where I need your eyes and your ears to pick up who are those people then that are going to be key. And obviously we want to reduce the amount of travel, so we want those community health supervisors to be at least in the general area of their community health workers, so there's not a lot of logistical problems and a lot of travel involved, particularly during the COVID-19 epidemic. So the selection of community health workers will be very important. Now, looking back at this in a couple years, we may find that one supervisor for every 20 community health workers may not be the number that we end up with. Or we may find for the first year when we train a program, we start with one community health worker supervisor for every 20 community health workers. And then later, maybe the second year, when our community health workers know the program, we may be able to make the program even more efficient and use one supervisor for 30 community health workers, or even one for 40. Only time will tell what we're going to need to do. But the more cost effective, we want to keep this medically efficient and medically effective, but also cost effective, because remember, our plan is not only to roll it out countywide, but nationwide, and then to roll this out across East Africa. So our products, our flip charts are going to have to be excellent. Our data reporting is going to have to be excellent. And again, as I talked about in the first presentation, one of the major responsibilities for us of the community health worker supervisor is that they will be the portal for the data coming back from the community health workers. So the data that the community health worker gets in the field, how many households they saw that particular week, what some of the problems were, whatever the data points we're going to collect, then that gets funneled back to the supervisor on a weekly basis, and then usually probably by just cell phone, if not in person. And then that community health worker supervisor is responsible for getting that back centrally to Hope Corps, and that's how we keep up our database, which is going to be so critical when we then approach governments and foundations and show them the incredible cost effectiveness of what we can do and how quickly we can do it. And that's why, again, I want to focus on the fact that when we do a campaign, is you don't roll the campaign out over 3 to 4 months. You get ready for it, and then you roll it out over 3 to 4 weeks, because everything will lose its energy if it takes too long in the field. So it's been shown better to get all ready, to produce everything, get it all set, all the flip charts out there, and then you focus on kind of a race to get each of the community health worker 50 households done in a 3-week period. And I think they can do it in 3 weeks. There's no reason, if they're neighborhood community health workers, that they can't at least see 4 a day, and at 4 a day you could actually get 20 a week. So I really think we could do this if our community health workers are motivated and well trained by the community health worker supervisor, that really we should run these campaigns in at least 3 weeks, and maybe 4 if we need to. What the salary is going to be on community health workers, I'm working with Naomi right now and our foundations to find out what that's going to be. We're going to need to incentivize them. The better the community health worker supervisor is, that's really is going to be the key person in our program. And remember, we will probably be training in small groups these community health worker supervisors by our Hope Corps staff every 4 to 6 weeks. We will set up a 1 day or maybe just a half day training. I really don't think, when we get this flip charts going, it's going to be pretty straightforward. And in just 2 or 3 hours, we should be able to educate the community health worker supervisor on the important points of these flip charts and how to do it. And again, the more flip charts they see, the more campaigns they go through, the supervisors are just going to get easier and easier and easier to train. And obviously, when we get this running, while we're doing one campaign, let's say COVID-19 like we are right now, then we have a part of our team that is preparing the flip chart for the next campaign when COVID-19 finishes. Let's say in this case, it's WaterGuard, hand washing soap, and latrines. We have that prepared so that a week or so before the COVID-19 campaign ends, then we begin to train all the community health worker supervisors on the new flip chart, and then roll that out during the next period of time. And again, we're going to shoot for about 10 of these a year. So I think that's enough for part 2, and we will then be back and look at some of the other issues that we're going to see in this program. But again, for now, we want to focus on COVID-19 flip chart, get that into the community. We want to have part of our Kenyan team working on the Memorandum of Understanding and the approach we're going to use to the ministry, so that we get there okay for at least a year-long program, with the emphasis as focusing on COVID-19. And then we're going to focus hard on the selection of really excellent community health worker supervisors. Again, the more energy we put into that, the better off we will be in the long term. Okay, thank you very much.